Good afternoon, everyone. Welcome to our Facebook Live Coronavirus Q&A with Karen Reissmann and Dr. Lee Humber. If you've been already tuning in, you'll know that this is a series of Facebook Live meetings that we've been doing during the time of the pandemic. The previous two are available on our Facebook channel and also our YouTube channel, SWP TV UK. And this video will also be available shortly after broadcast. For all those who are tuning in, please tweet and share the video widely so we can reach as many people as possible. You can also use the hashtag #HealthBeforeProfit. For anybody who's tuning in for the first time, welcome. My name's Sophia. I'm going to be chairing this afternoon's Q&A. And obviously, it's a really uncertain time. Things are really fast moving and we're all trying to stay on top of things. But I'm sure, as I do, we all have many unanswered questions that we've yet to hear kind of appeasable answers to. So please do comment in the links below throughout the meeting and we'll try and filter in as many questions as possible in the second half. Just to let you know how the meeting's going to run, firstly, both speakers are going to give about a 10-minute introduction and lead off. During that time, like I said, please keep commenting. I can see them and we'll be able to ask them afterwards. Our first speaker is Dr. Lee Humber. He is the author of Vital Signs, The Deadly Cost of Health Inequality, which is a fantastic book. And he's also been writing recently about the COVID-19 crisis, which you can access online. And our second speaker is Karen Reissmann. She is an NHS mental health nurse and also the Unison Union National Executive. But I must say she's here speaking in a personal capacity, which is a very great one, but just to let you know. So I'm now going to pass over to a pre-recorded video that Lee's done, which is very nicely filmed outside to give us all a little bit of escapism. So over to Lee.
I'm Dr. Lee Humber. Over the last few months I've written extensively on the coronavirus and other epidemics around the world, and most recently I've published a book called Vital Signs, The Deadly Cost of Health Inequality, in which I look at various things to do with health, but most in particular to do with something called the social determinants of health approach. It's not my approach by any means, but I didn't discover it. In fact, it's been championed by organisations like the World Health Organization. Briefly, social determinants of health means that our health experiences and therefore our ill health experiences are all contextualized socially by various elements of the society that we live in. So for example, what kind of work we do and the conditions that we do our work in has an impact on our health. The accommodation that we have available to us has an impact on our health. The kind of diets that we've got has an impact. Even our access to political rights has an impact on our health. So using the social determinants of health approach, what we can say now is, at a very general level, the kind of society that we live in is a capitalist society. And we know, don't we, that what drives capitalism is the need for profit. Capitalism seeks to exploit the work that we do in order to generate profit. And so we need to understand health and ill health in that broad context of a capitalist need for profit. And equally, we need to understand coronavirus, and very importantly, we need to understand the other epidemics that are sweeping the world and have swept the world for the last decade or so, because very, very importantly, coronavirus isn't on its own. We are living through an era of epidemics. People might be familiar with some of the more common ones, things like SARS and MERS and the Ebola epidemic that is still devastating parts of West Africa. And people might be aware also that flu epidemics are a constant threat to large parts of the globe. All of these things are structured, are contextualized by the capitalist society that we live in. Let's be absolutely clear. This is not some kind of natural disaster. This is not some kind of nature versus human beings. This is capitalism designed to profit the few versus the needs of the many. And coronavirus, of course, illustrates this very, very, very clearly. If we think about where we think coronavirus has come from a process of deforestation to expand agricultural production. Let's be dead clear about that agricultural production. That is not true, but agriculture isn't being expanded so that for some kind of humanitarian reason so that we can feed the world. We don't feed the world. We can feed the world, but we don't feed the world. Agricultural production is being expanded for one thing and one thing only: to generate profit for the food industry. century. In that process of deforestation, what's happened is we're discovering ever new and ever more potentially lethal viruses which are being let loose on human society. So in that sense, the profit drive has let loose coronavirus. As I say, coronavirus is only one amongst many epidemics. Year on year, new strains of potentially deadly viruses, pathogens, are generated by industrial farming practices. If you think about the way that poultry, and in particular chickens, are reared, they're reared in massive warehouses, 10,000 strong chickens living cheek by jowl, living, dying and catching diseases cheek by jowl. What capitalism does in that process is it generates exactly the right environment for new and ever more lethal pathogens, ever more lethal mutations of viruses. And so at that level, the capitalist drive for profit has produced these viruses, pathogens and epidemics that are sweeping the world. But there's another element to the way that the drive for profit creates the crises, the health crises that we're seeing at the minute, and that's by weakening host populations. In other words, weakening us, weakening many sections of us, making many sections of our human populations more vulnerable to disease. People might know that the people more likely to die from catching coronavirus are people from so-called vulnerable groups. What do we mean by vulnerable groups? Most often we mean people with underlying conditions. If you like, the diseases of the modern age, people with a history of heart disease, people with cancer, people with diabetes, people with obesity. If you look at these groups and their what are called case fatality rates, the percentage of these people with underlying conditions who die once they've contracted coronavirus, the percentages for these underlying conditions are much higher than people who haven't got underlying conditions. So if you've not got an underlying condition and you catch the virus, you're less than 1% likely to die from the virus. If you've got diabetes, you're more like 8% likely to die. If you've got heart disease, you're more like 10%. So in those diseases of the modern age, themselves determined socially by the way that capitalism provides accommodation, employment, diet, political rights for us within this general context of seeking to generate profit for a few, those underlying conditions have made us vulnerable. But there's another even more pernicious and even more disgusting way that people have been made vulnerable. People who know that older people are more likely to die once they've contracted coronavirus. In this country at the moment, there is what some claim virtually an epidemic amongst older people of malnutrition. Malnutrition of older people in the 21st century, and that's weakening their immune systems, making them more vulnerable. If I tell you that some recent research found that on average residential homes for older people spend something like £2.40 a day, £2.40 a day on feeding older people in residential homes. That's something like a weekly shop of 15 quid. That is completely not up to providing the nutritional intake that older people or anybody else for that matter need. So we can see that profit motive that is inherent, endemic in capitalism on two sides has produced this current era of epidemics. First of all, it provides the perfect breeding ground for producing deadly pathogens, deadly viruses, and throwing them out into human society. And on the second hand, by the profit motive, it produces more and more vulnerable groups. And so here we face a very stark choice. When and this virus, this global lockdown comes to an end, and we don't really know when this is going to come to an end. There are all sorts of guesses, but we don't really know. When it comes to an end, we will be in a very, very different world to the one that before it started. We will have lived through a period when, in all likelihood, all of us will have seen friends or members of family die as a result of this virus. We would have seen leaders from all over the world acting utterly incompetently, maddeningly incompetently, for their own self-interest, abandoning the vast majority of the needs of people around the globe in defence of their own interests and their interests of their capitalist class. So when this comes to an end, we will be faced with a very, very stark choice. We can shrug our shoulders and say, oh well, that's over with, that was really bad, let's continue, let's make do, let's see if we can get conditions a little bit better under this system, dependent on profit. We can do that. And if we do that, the consequences are we live with this constant threat of deadly pathogen, of deadly virus, of pandemics and epidemics. We live with that hanging over our heads and over the heads of our kids. I personally don't want that. So our choice is we shrug our shoulders and say, oh well, we need to carry on and make the best of it, or the other choice is that we work together, man and woman, black and white, gay and straight and whatever. We work together to try and find ways to make a new world, a different world that is based on the need of the many, not the profit of the few. We try and work together to make a socialist society. It's up to us.
Great, thank you so much for that pre-recorded video, Lee. That was absolutely fantastic. Solidarity, I definitely agree with the ending sentiment. Just to let viewers know, Lee is here with us live, so he will be able to answer your questions, which I've seen loads are already coming through. There's some really great ones. We're now going to head over to Karen Reissmann, who, like I said, is a NHS mental health nurse, and she's going to lead off for, again, about 10 minutes. So please keep commenting your questions for both speakers throughout this. So over to you, Karen.
Thanks very much. I think what Lee's done is Lee's shown us the context in which this virus is hitting us, that capitalism wasn't delivering for people long before this virus turned up. But one of the things about the crisis is it shows in much more stark contrast some of the contradictions about capitalism and its inability to meet our needs. We keep being told the market is the only way that you can get what you want, it's the only way to deliver. And what is clear is when we need to get things delivered, that capitalism and the market has completely and utterly failed us. It failed us because from the beginning they didn't take it seriously and they sat on their hands for weeks. It's failing us now. We're not delivering on the personal protection equipment that we need. It's not delivering on testing. It's not delivering on giving people the pay that they need so that they can cooperate with the social distancing that we need. It's failing us because it's still allowing a whole set of industry that isn't essential. I was in the park the other day and was talking to somebody who made military bridges, and the whole factory is open and not socially distancing at all. That's the real risk that we face, and those risks are turning into tragedies of deaths that are growing as we speak. And we see, I'll just share to do some technology. But if you look at some of those tragedies, these are pictures of some of the first health workers who've died in this. In Italy, you have 14% in Spain, you have 14% of people who've been infected with this virus are health workers, that the failures that they have are leading to an increased death that we don't need to have. And we hear them blaming and scapegoating for years. They've been scapegoating migrants as responsible for the mess of the health service or the mess of housing or the mess of benefits. And yet you look at the people who have died and the tragedy, all of them, black, minority, ethnic, lots of them migrants, and it is still true that you are more likely to be treated by a migrant than you are to be fighting for a hospital bed with a migrant. And I think we have to celebrate the fact that the people in front of us and the hundreds of thousands of other people who work in the health service today are actually the people who've made our health service, who've made our world a better place, and are still fighting today to do it. And I think that leads to people, let me just come off the share. Thank you. I think that leads, when we look at those figures, it leads people who go to work to care and to help help people to feel a growing sense of anxiety as every health worker walks into a hospital at the moment. What will happen? Will I be all right? Will I be the next face that's on that list? But it's also a growing set of anger. And to be honest, when I watched the BBC News last night and they said that 2 nurses had died, and then immediately followed with, if you want to stop more, then you have to stay in. What you see is a government that is trying to say, it's not our fault that we didn't start all this earlier stuff. It's not our fault that we didn't give you the equipment. It's your fault because you're still going out in the streets. It's the people who are walking in the countryside. It's the people who are still going shopping. It's your fault. And we see that scapegoating of anybody but themselves is what the Tories are attempting to do, to take the heat off themselves. And I think capitalism has always had a choice. It's had a choice about what it does in every circumstances. It can either do things because they make money, or it can do things to meet people's needs. And it only ever meets people's needs when it suits them. So if it suits them to keep as well, then they do that, or when we can make them. And I think the whole of the way through the NHS, there has been a priority that the NHS has chosen to prioritise the areas of the health service that actually get workers back to work as quickly as possible. So you look at surgery, you look at orthopaedics, you look at health for working class people, and you look at health for children, which is future working class people, has always been the priority. When the Cinderella services, the ones where you have to scrabble for every pound and every penny, are the elderly care, the chronic disabilities, the mental health. And even now, the priorities, when they're doing testing, is not about trying to reduce the level of infection, but it's about how can we test the people that health workers live, the ones who are self-isolating, to get them back to work as quickly as possible. And that's what capitalism's about. It's about trying to get people to work as quickly as possible. I'm just going to put another slide up, if I can find it. This is a slide that's really quite shocking. Jeremy Warner, who's one of the assistant editors of The Telegraph, said just a few weeks ago that given that this flu, unlike the Spanish flu in the First World War, which killed a lot of people of working age, this flu kills a lot of people who are old, and actually felt that it might be mildly beneficial in the long term by disproportionately culling elderly dependents. And the fact that capitalists feel that they can actually put that in writing is, for me, quite shocking. People may or may not know, but Ted Heath, during the 70s, had a discussion as to whether or not they wanted to put limits on smoking. And in the cabinet minutes, it says, he said, well, actually, workers who smoke, male workers who smoke, die around 64 and a half. And that's a perfect age for us because they work and then they die. And that is really what they want from us. And it is quite shocking that that's what capitalism does. Even more shocking that they say it out loud and have no shame about it. Because for capitalism, health means business. You see Trump on television, surrounded by all the private health providers, rubbing their hands with glee as they're being asked to provide healthcare. And for them, that's not general healthcare. That's the healthcare that they can make money about. It's not about treating poor people. It's about treating people who can afford it and the people who can't afford it going without. And actually, you end up with the same situation like you do in, say, housing, where rich people end up with more houses than they know what to do with, and poor people end up without housing. In America, rich people end up with more health than they actually need. So extra operations, extra medication, extra investigations, which they don't need, which actually means it's bad for their health as well and costs twice as much and doesn't deliver for the majority of people. So we have enough healthcare, but we give far too much of it to the rich, and we don't give very much at all to the poor who end up dying. And I think that's the consequence of the mad capitalist system that we live in. And the crisis that we see now is only going to get worse. And you'll see health professionals over the next few weeks having to make choices about which person you're going to get in an ambulance and which people you're going to leave at home, even though they would normally get healthcare, but we just haven't got it at the moment, who we're going to put on a ventilator and who we don't. And they're going to rule people out in the same way that they do already when you're waiting for a surgical list. If you're overweight, if you smoke, if you're old, well, you're not going to do as well. So what we'll do is we won't put you on the list until you've stopped smoking or until you've lost weight. And those things are used to ration care. And it's not done to help us, because if they really wanted to help us, they wouldn't have decimated smoking cessation groups. If they really wanted wanted to help us, they wouldn't have privatised all the gyms and made them unaffordable. They wouldn't have cut the drugs and alcohol service to a ribbon. They actually want, you know, us to be in a position where there isn't enough, and it's almost like if you could only save one of your children, which one of your children do you want to save? And that's the horrible position that health workers are going to be in, and were in before, but on a scale that we've not known of at the moment. And I want to end really by saying that sort of, you know, that really the anger and the fear that exists and the realization of what capitalism can do to us, I think is beginning to hit home to workers right across the world. The anger about what we're doing. The danger is that it's bypassed and sidelined into scapegoating anybody but the government and big business. But I think for us, we have to organise. There's a rally, an online rally, People Not Profit, Solidarity with the NHS, with John McDonnell speaking on Wednesday. And I would encourage everybody to both come to that, but also to share it so that we can get as wide an audience as possible. And we want people to come not just to show thanks and to show gratitude, for which health workers are incredibly grateful and appreciative, but we actually need a bigger side to organise, to demand the things from our government, to have a voice for people to say we need those things now. And lastly, we need to say we are never going back to the world that we had before the coronavirus, of cuts in the health service and the sort of capitalist system that leads to the more likelihood of these viruses coming.
Brilliant. Thank you very much, both Karen and Lee. We now got plenty of time for questions and contributions. I've got 3 questions lined up here, but as I said, please continue to ask your questions throughout the time, both when I'm repeating questions to you and when both speakers are having time to answer, as there will be a second round, if not a third, of questions. So firstly, Isabel asks, the crisis has brought to light awareness of issues within the NHS, such as low pay and underfunding, the education system, the welfare state, and in many other areas. When normality somewhat resumes, how do we ensure that things don't just go back to normal and that these issues are dealt with properly? That's our first question. We've got a question from Kim. Kim asks, how can frontline NHS workers use their industrial muscle to make demands on their behalf and ours at such a time of crisis? And lastly, we've got from Tony, should we be building a united campaign with a common set of demands for trade unions and socialists to demand in the immediate period following the lockdown? Just whilst our speakers are thinking of their responses, I'm going to come to you first, Karen, by the way. We've also had a comment from Catherine. Catherine says, thank you for talking about malnutrition. As a dietitian, my role is seeing malnourished patients in hospital, and in many cases, it's linked with health conditions. COPD, heart issues, cancer, and can be an issue post-stroke. Currently, I've been working in ICU seeing COVID patients, many of whom are male, overweight, and additional health conditions. That links in with the politics of health, what Lee was talking about in his book. So I'm going to go over to you now first, Karen. You've got roughly 5 to 7 minutes to answer the questions, and then we're going to go straight to Lee.
Okay. I think Isabel's right. I think that people are increasingly aware that this isn't just a problem that's been brought about by a virus. The NHS couldn't deliver before the virus. We had 100,000 unfilled vacancies in the health service, and already there were queues of ambulances outside hospitals. It's only the fact that this winter's been very, very mild that hasn't been even worse than it was before. They've closed 17,000 beds in the last 10 years, and therefore we are, I think we're the 3rd worst country for beds per population out of the whole of the EU. And that puts us at a real disadvantage. When you look at the list of beds across the world, I actually got a graph that I could put up. I could share, just hang on. If you look at the number of beds that the UK has, this is a couple of years old, but actually it's no real different, then it's not a surprise that the countries that are really struggling with this, the United Kingdoms, the Spains and the Italies, are actually near the bottom of that list. And the country that's finding it easiest or least difficult to deal with is Germany. And that's the consequences of the cuts that we've had for a long time. And when it looks at how can we use the industrial muscle of health workers to begin to make sure that we get what we need in terms of the working class at the moment, I think there has always been a moral argument that health workers have had, that somehow it's not right to go on strike, it's not right to be able to fight for your patients because you have to be there. And I've been on strike quite a lot of time in my life, and it's not easy to walk away from the patients that you work with. But for every day that we don't walk away, for every time that we don't insist on the right personal protection, for every day that we allow them to close wards, we allow them to scapegoat migrants, we allow them to continue racist policies of not treating migrants, then you end up where those policies continue and they close more hospitals and more wards. And I think that giving people the confidence at the moment when people are angry to be able to do that, and there is a growing movement in some of the hospitals to say, if you haven't got the personal protection equipment, then there's no service being provided. Work out how to do that collectively is difficult when you can't meet up to the usual mechanisms that we have. And I think using Zoom meetings, using sort of, some of the internet stuff that goes on, but for people on the ward to know that we're supported when we make those sort of decisions, I think is going to be important. And at some point that will come to a clash. Currently, when staff are doing it, I think they are being told, okay, we understand that. But I think it is something that we need to do. I think the final question about a united campaign, I think that is important. There's a list of demands that are on the Keep Our NHS Public site that are about the things that we need in order to make 6 demands that have come from a number of medics who were in Unite originally, I think, and from Keep Our NHS Public. And I think they're quite important that we look at trying to organise around what do we actually need at the moment.
Brilliant. Thank you very much, Karen. Same amount of time for you as well, Lee. So over to you.
Okay, thank you. Just in response to what we do, I think all of the questions had a kind of common thread to it. What do we do? How do we make sure that when we emerge from this crisis, that we're in good shape to carry the argument forward? Well, what we can do now is this, basically. I think it's really important to think about ideas, very much ideas as weapons. And I think it's fantastic and a great stride forward for our class and for the left generally that we're starting to use this sort of technology, using virtual meetings and other means to come together. Just an example, in the process of building for this meeting and for the 2 previous meetings, I've been able to draw together a bunch of people from who I've worked with over the time, trade unionists, members of people attached to various left groups, etc., green groups, etc., and keep in constant contact with them to bring them to a focus around things like this, because I think it's essential that we are absolutely clear in our heads about the causes and potential solutions, causes of this crisis and the solutions to it. Karen made the point, didn't she, that already from their class, from the government and the rest of them, from people like the Telegraph, astonishing quote from the Telegraph, they're already seeking to blame things like, oh, well, we've told people not to gather in groups, but look, they're still gathering in groups. Oh, these people aren't social distancing and all that sort of stuff. It's complete and utter nonsense. That doesn't get anywhere near the real problem. The real problem is much more rooted in things like there aren't sufficient testing kits, and things like that fatal pause at the beginning when they decided not to close the schools down, not to enforce a lockdown
in the guise of this completely bogus idea of herd immunity, which is a complete and utter lie. That's where the blame lies, in their hesitancy, their incompetence, their lack of resources being given to us. Just on the testing kits, I saw, maybe other people saw it, there's a company now selling testing kits, and they're selling testing kits, they say, to richer people to help stop shortages in the National Health Service. It's nonsense. It's companies profiting from selling testing kits. Incredible. And just on the other point about using our industrial muscle, I think that's so important to remember. Also, it's so important to remember that it's not just the industrial muscle of health workers. We have all got a collective interest in whatever trade or industry we're in fighting for better health. It is a matter of historical fact that there are two periods in the history of UK capitalism when health has improved. Those periods are the 1850s to the end of the 1800s to 1900, and then from the 1940s to the 1970s. What have those two periods got in common? I'll tell you what, they've got in common that during those periods, the working class collectively, in all its parts and elements of it, was strong. They have never, ever given us, the capitalist class has never, ever given us anything, including our own health. We've always had to fight for everything we've got, including our health. You look at the 1850s to the 1900s, that's when the trade union movement massively expanded, when socialism as an idea and a set of organisations took root. In other words, when the capitalists could smell constantly in their noses the threat of revolutionary upheaval from below. The NHS itself, let's be absolutely clear about the formation of the NHS itself. That was not given to us. We organised and fought for the National Health Service. That came as a direct result of our class being strong throughout the war. I mean, I could give you the details. Maybe you should read the article I'm going to get published in the review in May, because I talk about it in detail there. But during the war, strike days went up. The trade union movement went from 6 to 9 million people. In other words, the balance of class forces tipped in our favour. That's why we got the National Health Service. That's why we got a period of welfareism that benefited our health throughout the 70s until actually the end of the 1970s. I talk about this in the paper I'm published that will get published in the next couple of months' time. You can virtually map the rise of what I called earlier on the diseases of the modern age, things like cancer, diabetes, obesity, and all that sort of stuff. You can virtually match the increase in the rates of all of those with the retreat of our class from the end of the 1970s. During the 1970s, one example, during the 1970s, there were about 100,000 cases of cancer. 2015, 500, in excess of 500,000 cases of cancer. What's changed in the interim? A genetic makeup hasn't changed in the interim. What's changed is the social conditions in which we live, in which we experience health, has deteriorated massively. We want to make sure that we've got a future of better health for us and our kids, then we need to organise industrially. And we need to start to do that now by getting round being absolutely clear about what the causes are and absolutely clear about what the solutions are. The solutions are a strong working class.
Great. Thank you both, Lee and Karen. We're now going to go into our second round of questions. Just to make it clear to both the speakers and the audience, we're going to have 3 rounds of questions, which I'm excited about because I think the more the better. So for all of those watching at home, another reminder that if there's something that you've just thought of or you want some clarification on, there's still plenty of time to comment, share the video widely and ask any questions you may have. So I'm going to go to Karen first again for this round. There's just 2 questions this round. Rebecca asks, what role does PFI have to play in this? And Dave asks, what is the exit strategy likely to be from this pandemic? So I'm sure very succinct, very short questions, but not necessarily that simple to answer. So straight over to you, Karen.
Thanks very much. I mean, the role of PFI is that they allowed big business to build hospitals, which we rent back from big business at extortionate rates and are bleeding the health service dry. Alison Pollock did some research a few years ago that said that over 20% of the money that goes into the health service is wasted on things like PFI, privatisation, the market processes, which are growing and growing and growing. So we have an army of people in the health service who don't actually contribute to healthcare at all, but are part of the billing, the contracts, the bids. Are you fulfilling your contract? Can you fill in this form? Can you make sure that you've coded that properly? There's a whole army of people who do that. Every single department now has a business manager as well as a manager, and their job is to make sure that you're fulfilling the contracts and doing the business and getting more business for the area, as if the work that we do is a business and a product rather than. And all that fragmentation helps to do is to create a health service where you do your little bit that you're contracted to do, but you're not interested in the bit next door where there's a gap, because if you do that, then your bit that you're contracted to will cost more. If you pay people proper wages, then you will be more expensive than somebody else who puts a bid in. So let's encourage you to cut your wages, and then we can tender at a cheaper price. And so PFI is bleeding the health service dry, and it's part of the reason why we are in the situation that we are when we started this crisis, and it's part of the reason why the rich loved the Tories. They loved Labour, who continued with PFI and put a large amount of it in. And I think that that's one of the things that I think has been highlighted by this. You just look at the way that we buy and sell things. Labour privatised NHS logistics, and then NHS logistics was then sold to one company. That's been divided into 9 companies. Those then are subcontracted out and subcontracted out. So now when we want to buy something, it's impossible to do that in any sort of logical, organised way. In terms of an exit strategy, Dave, I'm not sure that they have got an exit strategy. I think it's a bit like the Iraq War, where they go in and start something and don't necessarily have a clear idea. Sometimes we think they're more rational than they are. I think they make a lot up as they go along, and I don't think they have got a clear exit strategy. In some ways, I think their exit strategy is a little bit of what Jeremy Warner talked about, which is maybe we have to let people die, and that's the price that we have to pay in order to make business go. And part of that will be dependent on how hard people fight and organise in order to stop them using us as disposable things that are just there to make money. But I don't think they've got a clear exit strategy. I do think as we get nearer and nearer an exit strategy, this has cost them an enormous amount of money, and I think they're going to come and try and make us pay for it. And I think, definitely I can speak on behalf of health worker and social care workers, but I think all the people, all the supermarket staff who are putting themselves at risk by the number of people that they're exposed to every day, all the bin workers, all the other people who are providing that key worker function are not going to go back to just being badly treated and poorly paid in the way that we are before. And I think that's what the Tories want to do. They want to make us pay for it, and that will be some of their exit strategy. But I'm not sure that they're going to get away with that. But partly, again, that depends on how well we organise. And I don't think we've had a particularly good lead from either the Labour Party or from our trade union leaders, who've put quite good policies together. Some of the policies of what they're suggesting are really good, but they're not organising any fight. It's only this week that we've started to see our union leaders put any public demands on the government, criticising them for what they're doing. And I think that's been a real mistake, because they're not trying to organise and mobilise people in order to change the situation.
Perfect. Thanks, Karen. Now straight over to you, Lee.
Okay, yeah. So PFI, Public Finance Initiative, people might know. It was a period in the late 90s, early 21st century that millions of pounds were released supported by the governments to build new hospitals. Which government was in charge at the time? It was a Labour government. It was a Blairite government. And as Karen quite rightly said, the PFI has leaked out of care millions and millions and millions of pounds over the years since in rents. So hospitals have to pay rents to private companies. Now, as soon as you get something like PFI in, what happens is that health becomes, at best, a secondary issue. Now they're not concerned about health primarily. What they're concerned about is generating profit. And that undermines health. I've got a quote here from the World Health Organization that goes on ad infinitum about prioritizing economic growth and profit over the equitable distribution of wealth and so health and the provision of public goods and services. In other words, you put a system in that's focused on profit, then what you do is reduce the quality of health outcomes. So the PFI was not just the UK initiative, it was part of a broader global initiatives, something called PPP, public and private partnerships. It was all about using the vitality of private interest to improve health services. It had exactly the opposite effect. The health outcomes for people globally, including in the UK, since PPP, since public-private partnerships, has decreased. That's a matter of fact. The market in health does not improve health. It deteriorates it markedly. We need to be very, very clear about that, which is why the solution is not within capitalism. I said in my introduction at the beginning, for as long as we have a system that is based on profit, not need, we will have hanging over our heads the threats of epidemics, pandemics, the spread of what are called socially transmitted disease, cancer, heart disease, diabetes, and so on and so forth. The solution is not within the system. We need to go beyond the system to do this by some of the ways that I talked about earlier on, about working class strength and working class solidarity, which brings me to the second question, which is the exit strategy. I think Karen's absolutely right. In terms of the government and ruling classes, their strategy is, let's try and make sure that we benefit the most from this particular crisis, that we as a class don't have to pay much for it, and we'll see what happens with the rest. And if that means that we as a capitalist class have to enforce a neo-police state, then so be it. And you know, let's not be, I don't say that flippantly. If you think about the conditions in China, for example, people with the virus have been tagged. If you go to France, people with the police presence on the streets of France is already massively up, and people are being asked to for all sorts of ID credentials just to go and do the weekly shop. So that threat of a police state, pseudo-fascism, that threat is hanging in the air, and we need to be very, very clear about it. So we need to be clear about our exit strategy, our class's exit strategy. And that comes back to what I was saying before. What we can do now is collect around this kind of thing and make sure that we build our networks across trade unionists, across left organisations, across socialists generally, so that when this thing comes to an end, whenever it does come to an end, our class is very clear about the causes of this pandemic and epidemic. It's their fault, their system, their profit-driven system that has caused this. And we've got as many people as possible who recognise that and are willing to oppose what the capitalist class is suggesting as some kind of strategy.
Great. Thank you very much, Lee. So now we've got our final round of questions. Got some very good ones here and some about recent political events. So I'm excited to see what both of our two speakers have to say. Our first question is from Alex. Alex asks, how do we tackle the current attempts to blame for the spread of the virus? I've only got half a question there, so maybe it will send me through the rest. The second question from Tom is, Keir Starmer has been elected leader of Labour and said he will work constructively with the government. Should we be supporting Johnson at this time in the crisis? Sorry to ruin the news if nobody else has been following. I'm sure we've all heard by now. Our third question is from Emma. Emma says that the crisis has exposed at every level how incapable capitalism is and why we need socialism. How do we fight for this during the lockdown? Is the slogan "no going back" one we could use internationally? And I'm just being given the second half of the first question, so please bear with me. Here's the first question to repeat for you again. How do we tackle the current attempts to blame ordinary people for the spread of the virus? So hopefully both our speakers have got these questions. I'm going to come to Sorry, I've lost my words there. I'm going to come to you, Lee, first this time, just to shape it up a little bit. So over to you, Lee, again.
Okay. All right. Just briefly then, just to comment a little bit on the election of the Labour leader. Let's be clear, that's Sir Keir Starmer. So we've got a Knight of the Realm in charge of the party of the working class. I'm trying to think, and I've been thinking all morning actually, when was the last time a Knight of the Realm did something beneficial for the working class? And I've not come up with something yet, so maybe people can suggest that. But let's be very clear. As we said when we were discussing the last issue about PFI, it was right-wing Labourism under Blair and Brown that introduced public private partnerships into the health service, which has seen a massive deterioration of the health service and all sorts of sell-offs of different parts of it. So can we trust Sir Keir Starmer to lead our recovery? Maybe I'm an old cynical bloke, I certainly am an old cynical bloke, but I don't believe so. Having said that, of course, then how far Sir Keir Starmer will represent the views of the many, probably millions of Labour Party members, some of whom I've worked with closely over the last 10, 20, 30 years, how far he will represent their views is up for grabs. I think there's probably a great majority of active Labour Party members who are appalled by this, who understand just as well as anybody else who's been involved in this programme that this crisis is caused by capitalism and its striving for profit at every occasion, and to work with those people, work with the ordinary Labour Party members over the next few years is absolutely essential. How do we make sure that ordinary people don't get the blame for that? We have to. It seems to me the only thing we can do is constantly oppose any sorts of generalisations about these mad people in supermarkets hoarding toilet paper and these people who refuse to socially distance. It's the talk of the Daily Telegraph. That's that kind of thing, is the talk of the Daily Telegraph. When in doubt, let's blame the mob. Why do they blame the mob? Because they fear and loathe the mob. They fear and loathe ordinary working class people and our potential to overthrow their system.
Stuff. Thank you very much, Lee. And over to you, Karen, for our final words of the meeting.
Cheers. We'll start with Alex's question about sort of how do we tackle the fact that they're going to blame ordinary people for spreading the virus. I do think it's quite important that wading through all the barrage of information that's out there, that there is a clear socialist voice that explains the things that Lee spoke about at the beginning, about where do viruses come from and how do we end up. Just like global warming and rain and floods and droughts and all the other things are not natural disasters, but they are a product of the capitalist system that we live in. Viruses are a product of the capitalist system that we live in, on the scale and the frequency and the damage that they can do. And if we want to rid our world, right, and it won't be easy and it won't be quick, but we do have to do that, then we have to change the way that our society is organised. And I think that the first thing we have to do is we have to explain that to people. We have to have that debate and argument with people, because for lots of people, they have no idea about the stuff that some of the stuff that Lee talked about at the beginning, or that Joseph talked about at the meeting last week, about where viruses come from in the current context. And I think it's important. I think on top of that, we do have to have the arguments about, the people who are, the police are going around stopping so many people. I am sure they are spreading more viruses than any of the people who are out there actually going for walks and trying to keep themselves sane during this very difficult period. Often, in the middle of a hill, on top of a hill, who exactly do you think that you're going to be infecting while you're doing that? Hoarding is a really typical example. The real hoarders are not the people who bought 25 boxes of toilet rolls, but they're the Richard Bransons, and they're the rich people of the world who actually hoard for a living every day. And it's that hoarding that means that ordinary people do without. And I think we have to be clear about that, because it's easy to pick on the person that you can see that they've got a film of. They don't let us in Richard Branson's house, who's ripped off the health service for years and years, or the Apple who don't, and the Amazons who don't pay any tax and somehow live in a bubble and think that, oh, this is nothing to do with me. I don't steal toilet roll. That's because you don't even do your own shopping. How would you know whether you'd stockpile? You stockpile for a living. And it does make me angry when they pick on individuals in order to do that. And I think we have to be as hard as nails as that in order to make that argument. I think we have to be as hard as nails over racism, because there is a whole set of undercurrents of racism that comes through this debate that are absolutely disgraceful. This is not a Chinese virus. This is a virus. It comes out of capitalism. It happened in this case to start in China, but it arises out of capitalist methods. And I think we have to be absolutely clear about that and not allow them to adopt any sort of racist idea. I think the idea that's going to sort of, come about now that we've had all this terrible thing happened, maybe we need to close the doors, we need to stop letting people in. I think after this, there's going to be an increase in racism. Even now, you look at Portugal and Ireland, who've managed to say to undocumented refugees and asylum seekers, there is absolutely no harm. You will be treated for everything. You won't be charged and you won't be reported or deported. In Britain, we're incapable of doing that. We say, if you've got coronavirus, we won't charge you or deport you for that, but we will somehow deport you if you happen to have ordinary flu, or you have another disease of poverty that might end up at the door of the health service. And I do think that sort of racism has to be challenged and has to be dealt with, because really the last question, well, now I'll move on to Starmer, because I think one of the problems with Starmer, I mean, it's not a surprise to us that he's been elected. They've been predicting that for a long time. And sadly, I think it somehow sort of means that people bought the idea that Corbyn didn't get elected because he was too left-wing, rather than that I think Corbyn was continually pulled in the time that he was leader to the right by the other people in the Labour Party, by the very people who then blamed him for losing the election, who consistently undermined him. And I think the pressure that he was under led him, Jeremy Corbyn was someone who you would hear speak at all the demonstrations that you went on, and suddenly he felt like he couldn't do that because he was told he had to be prime ministerial. And I think that's been a problem for them, that they haven't appealed to that anger, the anger that at the moment is really, really raw. And in a way, Keir Starmer is definitely not going to mobilise any of their fact. The fact that he's talking about working constructively with a bunch of people who have ignored the disaster in front of them, who haven't done the things that they needed to do, even within the crappy capitalist system, haven't done the things in the last 3 months that they could have done to make this crisis better, to somehow think you can work constructively with them. They need to be gone. If we want to save lives, then the Tories have to be gone. And we have to be saying it's them, it's their partnership with big business, it's the policies and the ideology that turns down an offer to buy ventilators with the EU because we don't like the EU. And people will die because we haven't got those ventilators. In the community, people will die because they haven't got the syringe drivers and the morphine, because they haven't made the plans that anybody with any sense knew that they ought to make. And I think the last thing I want to say is about sort of, how do we make clear to people? I think it is becoming clearer to people that capitalism's incapable of doing this. You only have to look around you. I think the argument over PPE, for the personal protection equipment, the argument about testing, the argument about waiting is one that is out there in the population. And I think we have to make sure that we say we are not going back, right? And that we will be mobilising in order to do that. I think for lots of people who look to the Labour Party, who look to Corbyn, and that raised their hopes, they also worked within the Labour Party and have battled those internal battles. I think the time has come to say we need to organise where workers are strongest, which is at work. We have to support every health worker, and there are health workers up and down the country in my trust who are saying we are not doing that. We're not going into the office, or we're not working with that client until you give us the equipment. We're not doing that injection until you give us the gloves and the mask. We have to support the Lambeth Library workers who walked out and said no. And there will be workers up and down the country, bin workers, shop workers, who are creating facts about being able to fight back. And that has to be something that we support. But ultimately, these things will keep happening unless we end a system that builds for profit. And I think that's an argument that we have to win whilst we fight for what we need to do today. And just like in the Second World War, people started with the 30s when they went into the war. They tolerated a whole level of horrors. But in those horrors, there were a number of people that didn't think we were all in it together, but continued to fight for workers' rights, to continue to fight for workers' interests, who didn't want to fight a British capitalist war, were happy to fight against fascism, but that also meant fighting against the British rulers that created those conditions. And I think we have to adopt those methods today. We support the engineers, we support the health workers, we support people who fight back, because we need a better world. And I think one of the ways of starting that is to come to the meeting next Wednesday, the people before profit, solidarity with our NHS, and begin to organise. But the other thing is, I think if you're not in the SWP, you should seriously think about joining us so that we're a bigger force that's organised in order to do that.
Absolutely fantastic. Thank you so much to both Karen and Lee, and thank you to everybody who tuned in. Just before we all return back to our daily lives, whatever we were doing to keep us busy, I've got a couple of announcements just to let you know what's coming up in the next coming weeks. Next Saturday, we're really, really excited. We're going to have an absolutely fantastic Facebook Live Zoom called Marxism in an Age of Catastrophe. Hopefully, there should be a poster flashing up on your screens shortly. It is with Mike Davis, who is a well-known author and historian who's based in the USA, and also with Alex Kalinikos, who's a Marxist author and academic. They're going to be discussing Marxism in the Age of a Catastrophe, 7 p.m. next Saturday. It's going to be absolutely amazing, so please do tune in to that. In terms of the meeting next week, and also Lee, who we've just heard from, I've mentioned that all three speakers are authors, and you can get a copy of all of their books. Some of them have got multiple online at www.bookmarksbookshop.co.uk. Of course, in this time of crisis, it's very difficult for independent bookshops. So if people could please support them, I'm sure their solidarity would be much, much appreciated. And lastly, just to leave you all with something that Karen finished on, I'm sure she can say it much eloquently than I did. But if you thought our analysis today was refreshing and you agree with what we said, then please do consider joining us. There's a link in the event description where you can join us. In the SWP, the Socialist Workers' Party, we're a network of activists, trade unionists, students across the country. And I think, in this time of crisis, heading potentially into an economic slump, we really need clarity and solidarity, which is what Marxism can offer us. And you can get involved in local campaigns, national ones, and even international ones. So please do think about joining us. And I will see you hopefully next week. In the meantime, like I said last week, please stay safe, but most importantly, stay socialist. So thank you very much for everyone tuning in. See you soon.